This episode is brought to you by my Fertility Friday group programs. New groups are starting in April of 2017, and there are only a limited number of spaces available. Make sure to head over to fertilityfriday.com/group program to reserve your spot today. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 132. Welcome to the 132nd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Hi, and welcome to today's show. I'm so excited to have another episode in my fertility awareness reality series for you. And today I'm interviewing Emily. Emily was part of my birth control group in my most recent Fertility Friday group program. And Emily jumped in to learn hormonal birth control, but what was interesting about Emily was that when she first applied, I had noticed that she had taken a class before and she had been charting for quite some time. And so we talk about it in this episode of, for me, my first initial reaction was, well, she has quite a bit of charting experience. I hope I'm able to support her, and I hope that I'm able to share with her more to really make it worth it. And I hope it's a really good fit. And so Emily shared how it helped to have this additional information. It's those things that I talk about on the show all the time. I mean, it's been my personal experience that I wouldn't be where I am today with my knowledge and confidence and all of my years under my belt of successfully using fertility awareness if I hadn't really understood the method and had the opportunity and the blessing to learn from women who knew way more than me and had a really solid understanding themselves. And so it was really through me learning in that type of environment that I was able to really gain that confidence and also to make those connections between fertility awareness and health. So to really recognize that it's not just about what you put on the chart, but how to interpret that and really how to understand the intersections between what's happening in your menstrual cycle and what's happening in your overall health. So I was really happy to have the opportunity to share that with Emily, and I'm happy to have the opportunity to share that with you today. And as this episode airs, we are just about to start our newest edition of the Fertility Friday group program. So my April groups are going to be starting right away here. Planning to start the groups towards either the second last or last week of April, just depending on how everything comes together. And so I do have 2 groups forming. I still have a couple spaces available. So if you would like to be part of the group, I would love to have you. It is a really unique experience. It's not something that you can really get anywhere, everywhere, to have this targeted group program where you're able to be essentially in a class with women who are in a very similar position to you. So, I divide you into 2 broad categories, but essentially, if you're trying to conceive, you're with a group of women who are in a similar position to you. Some who have come off of hormonal contraceptives recently, some who have been off them for a while, some who have already started trying to conceive and have been having some struggles there, and others who are planning to try to conceive in the future. So that is my conception group. And what has been truly amazing is to see the support and the encouragement that the women within the group give each other, because they really are coming from a place of understanding how you're feeling, because they're there with you and they've been there. And then the birth control group is also really interesting and fun because we're able to talk about some of those particular challenges that come up when you're utilizing fertility awareness for birth control. And so Emily and I talk about a few of those things in our session today. And I think it's just so helpful to hear that and to have it normalized, because although it's really exciting when you learn about this method and you want to jump right in, it actually takes several months before you can get to that place of 100% confidence. And so with the programs that I do, my goal is to support you with your goals, to help you to get to where you want to be with your understanding and knowledge. But ultimately, once you have it down and once we hash out cervical mucus, once we hash out temperature and really get to improve your understanding of it and have you have an opportunity to practice and do those things and then come back with your questions and we really solidify your knowledge, then you're really able to get to that place where you're confident, like you're good. And so I'm super excited for that. If you want to jump in and make sure to apply to the group programs while there's still time, make sure to head over to fertilityfriday.com/group program. If you have questions for me, if you're wondering if you'll be a good fit for the group, I definitely tell you, I know that, not everyone is a really great fit for the group. And I know I've spoken to a few of you who have booked 15-minute sessions with me. And so there are certain cases where, I'll be honest and I'll tell you, I'm not going to tell you the group is for you if I don't think it's going to be good. So if you do have questions and you're wondering if your particular situation would fit within the group, make sure to let me know, and you can go to the group program page, fertilityfriday.com/group program, book a 15-minute consult with me if you do have questions about whether or not, the group is right for you right now or anything like that. And so before we jump into the session, as I always say before I air my client sessions, I'm not a doctor. I don't play one on the internet. And so, keep in mind that all of the women who work with me, I'm part of their team. They're under the care of doctors and, naturopaths and all different types of health professionals. And so I'm a member of their team, and anything that we talk about is within the context of our professional relationship. And so I just want that to be super, super clear. And I know you all know that anyways, because you're all amazing, because the Fertility Friday community is so fantastic and supportive. So I know you all know that anyways. So without further ado, I'm just going to jump right into my episode with Emily. Well, I'm really excited to be here today with Emily. Emily was a member of one of my most recent group programs, the one that just ended actually. And so we were together for 10 weeks. We had a lot of fun, and Emily was in my birth control group. And so she has agreed to come on the show. She wanted to share a little bit about her experience and have what I always fondly refer to as a very public or a very private conversation in a very public way. So thank you so much, Emily, for coming on the show for our on-air client session today.
Yeah, thanks for having me.
Well, it's my pleasure. And so I have the pleasure of knowing you a little bit, obviously, over the last 10 weeks that we've been together. But I thought a good place to start would be for you to share a little bit about your own history just with hormonal contraceptives, how all of that went, and what brought you to wanting to actually use fertility awareness as a birth control method.
Yeah, for sure. So I was one of these people, I got my period quite late. I was about 16 the first time I got my period. And so I very quickly then was also sexually active. So in my adult life before I came to FAM, I had, there was about just under a year that I wasn't on any sort of hormonal birth control. And then, about a year after I got my period for the first time, I went on hormonal birth control, and I was on it for almost 10 years. And then I just got more interested in body literacy. I started to become aware of the fact that as a woman in my mid-20s, I actually had zero idea sort of what my body did when left to its own devices. Like, it had less than 12 cycles on its own before I was on the pills. So I became a bit more aware of that. And as I became more interested in sort of women's reproductive health and sexuality, I was introduced to the concept of the Billings method was actually the first sort of form of FAM that I was introduced to. And it took me about 3 years to sort of build up the courage to go off the pill, because for me, pregnancy, and it still is, I'm like a 0 on the intention scale. Like it's not an option. I would consider it catastrophic. And so I was very, very hesitant, because sort of the overwhelming attitude that I was finding towards FAM was like, this is great if you're with a partner and you're willing to like have an oops moment. And I was like, well, I'm not willing to have an oops moment. So it took me a few years to finally build up the courage. And part of that, I bought the wonderful Taking Charge of Your Fertility, which was a great, solid intro. But I got a little concerned because my charts did not look anything like the charts in the book. And I figured I could use some extra help. And I turned online because when I went to some of the resources in my hometown, there was nothing. Like, they had nothing to offer me. So I went online and I found some really great communities on Facebook and some other online platforms and forums. And through that, I was introduced to your group program. Someone made a post about it. And I decided at that point I'd been charting for almost a year, and I still didn't feel confident using it fully for birth control. I was fine with my sort of post-ovulatory phase, but pre-ov, I was still very, very uncomfortable going unprotected. And I saw the post and I thought, all right, I think it's been long enough that I've been trying to do this on my own. I think it's time I get some help. And it's been a fantastic ride so far.
Well, it's really, I remember when you first reached out to me, and one of the first things I noticed, so when because we had a Skype consult before, didn't we? I feel like we did.
No, but I did the intake form, like the super detailed one.
Oh, that's what it was. Yeah. And I remember on there that you had noted that you had taken a class before. And so I remember thinking, well, interesting. You've been charting for a year and you've taken a class. It kind of like what can I do for you? Right. Like you seem like you have a pretty solid understanding. And so I think that for me, that was actually eye-opening just to see that the level of detail of the method that I teach, it can be really helpful to clarify those things. And so maybe you could just share a little bit about that, because I know that was one of the kind of the first things when we did end up talking, because I said, you came to me and you had experience charting. And so it was kind of like the moment for me, like, can I support her? Because she knows a lot. So what can I actually do for her? Yeah.
Yeah, no.
Just always wanting to make sure it's a fit, right?
Definitely. And I think for me, ultimately, I was really comfortable with temperature charting. Like that was no problem. I had very straightforward sort of textbook charts in terms of having really evident shifts. And that's why post-ovulatory unprotected sex, I was generally fine with. Although it is interesting to note, I still, when I say unprotected back then, I still mean using withdrawal. I didn't consider withdrawal a protected method. So that's a whole other thing. But anyway, just interesting to note. But what I was really sort of lacking confidence with was my cervical mucus observations, because like I said, they were not following the patterns that I was hoping to see based on what I had read in my own research. And it's one of those things, it's super unique. You can only describe so much without, like showing someone a picture, which some of the online forums are great for that because you could share pictures and stuff. But I wasn't fully ready to do that just because I wasn't sure I was comfortable putting that sort of stuff out online. Yeah, I had some questions. I wasn't confident in my ability to read it. I was having a hard time distinguishing like what a dry day was. That was one of the biggest takeaways from doing the program with you is I came into the program thinking that I didn't have dry days ever because I was like, there's always something there. There's always like, what is going on? So when I then took the program and then leaving it and realizing that in fact, I actually have very few fertile days at all. So that was really interesting. But I found that the level of detail that the Just Yeast method goes into with the cervical mucus observations was really helpful. And I found that the descriptions that they use fit for me better because I had been introduced to the sort of general, you're either dry, sticky, creamy, egg white, watery. And I was like, well, I'm not really fitting into these categories comfortably. And there was no pattern coming out of it, even when I tried doing that. So that was the biggest, that's what you were able to help me with most was sort of deciphering that and finally seeing patterns showing up. But yeah, that was the biggest thing going from I have no dry days to I have too many dry days, if that's even possible. So yeah, that was very helpful.
Well, yeah. And I remember, so as we get into it, so as we got past the first couple information heavy sessions and got into the chart sharing and going through, I felt once I saw what was actually happening, I felt, okay, now I know what I can support you with. So, I mean, for today's session though, the place that is always a good place to start is the forum. And so it was kind of funny going through your forum, funny because it's like you totally have it now. So the same forum that I've in the previous calls that I've aired, which is you just kind of go through and it allows us to check where you're at with your confidence and your knowledge of just differentiating between different types of cervical fluid and all that kind of stuff. It seems like you've got a really good handle on it now, which is really, really great. So I feel like one of the themes in our early sessions together was really trying to figure out, okay, so what is the difference here between mucus, cell slough, what else is going on? And it's the same thing that I love about the charting protocol. All of the different ways to categorize mucus is that it categorizes mucus based on color, consistency, how much it stretches and sensation. So then there's all these different categories, but it helps you to at least like anything that could come out of your vagina has a corresponding notation.
Yes.
So we can always put it somewhere. And then
Exactly.
once we at least have everything written down, then we can start looking at the bigger picture of, okay, so is this healthy? Is this good? Or what's going on? But yeah.
Yeah.
And so you even touched on it just in terms of your own understanding of the method. And I think that this speaks to one of the themes that we spoke about a lot in our group, which is the heavy deprogramming that has to happen in order for you to actually allow your partner to ejaculate inside of your body and for you to actually know that you won't get pregnant as long as you understand the rules. So maybe you could share a bit about that, because I feel like that is something that every woman who uses fertility awareness for birth control at some point has to face, but it's not necessarily something we talk about a whole lot.
No, definitely. And that's still something that I'm working on. And my partner, especially, he has a lot of deprogramming to go through as well. As someone who's considerate and caring for his partner, he cares about, the pregnancy scare. And so we both have a lot of work to still do. But yeah, in general, like I said, my entire life, I had never, I didn't allow anyone to ejaculate inside me. That even when I was on the pill, and when I first went on the pill, I was also using condoms. We were there was no babies coming out of my uterus. That was not a thing. And eventually we got rid of the condoms, but we always still used withdrawal, even when I was on the pill. And when I came off the pill, then, when I first started, obviously for the first 3 months, I was using condoms all the time, just as sort of per the rules, while I was getting used to my body coming off of the pill. And then after that, I did progress to the point that I felt comfortable having sex without a condom in my post-ovulatory phase. Again, it was still withdrawal, because still that moment of, oh my God, this something bad could happen. And I have since moved on from that, and it's okay for full unprotected in the post-ovulatory phase, which was a big thing for my partner and I. That was a huge moment, because we had both been so paranoid. And it felt good though to finally, I knew he was a bit more concerned, but I knew, I was like, no, this is 100% fine. We're fine. We are fine. That was the thing. And then now, since in the following weeks, we're more comfortable using withdrawal in the pre-ovulatory phase, which beforehand we had used condoms. And sort of at the level that we're at now, sort of as soon as I see cervical mucus, we use condoms from then until post-op. It doesn't matter if I have 1 day of cervical mucus and then I have a couple of dry days. As soon as I see the cervical mucus, I get a little bit nervous, and I'm just more comfortable for now just using condoms. It's just peace of mind. I'm confident that one day we will move past that as well and really be able to follow sort of the just use method exactly. And we're almost there. I think we're at the step just underneath that, but it has been a very long deprogramming process. And like I said, I think it's one that both my partner and I are still going through, but I have confidence we will get there eventually.
Well, Emily, I'm so glad that you shared the whole trajectory, because I feel like it's so important to talk about that. And it actually triggered a random memory for me that's not so random. But when I was around that age where I was starting to be sexually active, I went the opposite route. I went off the pill. And it was interesting because from my perspective, the way that I thought about it was I could never trust the pill, because I had been on it from a young age. And I wasn't on it for birth control, so I was never taking it at the right time ever. And I read the whole manual, right? I was a nerd since then. So I knew all the stuff, and I knew you had to take it at the same time. And so I knew that I was not reliable to do that. Right. And so I knew instinctively that I would never be comfortable with having someone ejaculate inside of me anyways. So I was like, okay, so if I'm on the pill, I'm going to be using condoms all the time anyways.
Okay.
So then I trust condoms. So then why, what do I need the pill for? So that was kind of my logic. And I really like how you took us through the process, because that is one of the pieces that's really important for when you actually want to use this method for birth control reliably, to allow yourself several cycles to basically work up to it. It's a several step process. This is not a situation where you read a book and then you use the method 100%. It just literally cannot work that way, because it's like baby steps into the hot tub, right? You can't just, you could, but, whatever. But you see the analogy. I hope it's a good analogy, but you're using it. But yeah, so and that's natural and that's normal. And so having that first cycle where you are using condoms, or first several cycles while you're getting used to it, that allows you to figure out when ovulation is. And there's a lot of things that happen when you don't do that. Like when your ovulation is delayed and you think you've ovulated, but you don't really understand the signals. And then all of a sudden you end up pregnant. And that happens to a lot of women.
Yeah.
So, but also the emotional shift that has to happen. So it's a really big deal to allow your partner to ejaculate inside of you with nothing on an infertile day for the first time, in your post-ovulatory window. And this is, by the time you're at that point, you've already spent at least a month or a few getting to know your body, understanding your cycles, and knowing why this day is infertile. It's not a guess. You've confirmed ovulation. We got the mucus. So I'm really glad that you took us through that. I'm sure you know this by now, but one of the comments that I just wanted to make about something that you said was, one day I hope to be able to use the method like exactly how it is. And what guides each woman to use fertility awareness is her intention and her acceptability to risk. And so there's the spectrum of 100% not open to a baby right now to 100% I want a baby yesterday. So depending on where you fall on that spectrum is going to determine your choices. So it's okay for you to manage your fertile window and even those couple days after you see your first mucus, however you want.
Yeah.
Right. And there's no you need to use it this way or you need to not use it that way or whatever.
And I think one of the really cool things about FAM as well is it also involves my partner heavily, right? It's taking into consideration his comfort levels too, because I was willing to go unprotected, for example, post-ov for a while, but he was not ready for that. He was very honest about that. He just said, it's for my peace of mind. It's hard to enjoy having sex when you're super paranoid about, oh my God, this could cause this and this. And he was open about that. And that I, of course, respected that. So I think the neat thing about FAM is it does force you to have very, very open, honest conversations with your partner, which hopefully you're doing anyway, but not always, right? I think sometimes, especially when I was younger, my partners didn't really ask me about, they just kind of assumed that I had the birth control thing under control. And, they kind of take a much more passive approach to it. Whereas I think FAM encourages sort of active participation you need active participation from both participants. And I think that that's awesome. And it can be really, really, really beneficial, I think, to the relationship. And while I certainly sometimes miss the days of not really having to think about it and just being able to have sex whenever and really not putting it out of my mind, because I was really good about taking the pill at the exact same time every single day. I was meticulous about it. So I trusted it that way. And because we also were doing withdrawal. Anyway, all of that to say, I still think that the benefits of FAM and having those active conversations are super, super helpful and important. And I think it's a great benefit of the method.
Mm-hmm. Well, and one of my observations, just not even from a perspective of what I do with women, what I do with my clients, but just as a woman who's getting older, is that sometimes you make decisions about how you're going to approach a certain aspect of your life based on what makes sense for you at that time, obviously. So when you're 19 and you're having a conversation with yourself about how you're going to manage your fertility, it's a different conversation than it might be at 25. And it's a different conversation that it might be at 30. And I think that that's part of why having knowledge and awareness about your body and knowledge and awareness about the potential side effects of hormonal birth control and those types of things is important, because some of the scripts, I guess, that you've been talking to yourself about no longer apply. When you get to, just as you get to a different point in your life. So even for yourself, whereas I'm sure for the pill was the perfect option for certain periods of your life. That was the option. That was the only option. Yeah. But then as you reached a different point, all of a sudden, I was telling myself all of these things, but they no longer apply, because now I'm at a point where I'm a little bit more stable. I trust myself. I trust my partner. So things change. Yeah.
And I think too, I know I mentioned this to you before, the sex ed that I got, I grew up in a very sex positive environment, which was great. But the education I got around it was still very much sex can give you diseases and sex will get you pregnant. And that was oh my God. So I grew up very paranoid about it. And so when I decided to start becoming sexually active in a way that I could get pregnant. It was interesting because the only option really that even popped into my head was the pill. That was it, because largely that had been the option that had been presented to me most often and as most effective. So to me, it was a no-brainer. I was like, well, yeah, I'm just going to go on the pill and it'll be fine. And looking back now, what I get frustrated with, though, is that I was not given any talk about the potential side effects other than like, well, you don't smoke, so you're not going to get a stroke, so it's fine. And that was like the extent of, these are the pros and cons. I wasn't given any of that by my healthcare providers, which I think is really disappointing, that it was the only option. And it was the only option that any of my friends found out about. And I was very lucky in the sense that I didn't have side effects from the pill in terms of the immediate ones that you hear about. Like I didn't get headaches. It didn't make me moody. It didn't affect my libido. And I was very fortunate for that. But I had lots of friends who did. Like I had a friend who had migraines for years and years. And finally she went off the pill because she was like, this is the only thing that's been consistent. And sure enough, like she was fine. So I was lucky in that the pill was quote unquote a good option for me. But looking back now and in my sessions with you, realizing how it may have very well affected my fertility. And as much as I don't want a child now, I may later. And, there's been some real side effects that are quite possibly from being on the pill for so long. And I think it was very frustrating as I became more familiar with the method and the research around the method to realize that no one had even brought that up. And maybe it's because they didn't know themselves. But I think that's a little alarming that a primary healthcare provider wasn't able to give me that information. And I think that's too bad and it's frustrating.
Yeah. Well, in our pre-chat, I was sharing with you that I have been doing quite a bit of digging into hormonal contraceptives lately. And I've mentioned on a couple of the on-air sessions that one of the episodes that I have coming up is I've interviewed a few women from the Fertility Friday community who have experienced certain side effects coming off of hormonal birth control. And it's interesting because the stories are there's often threads of similarity, which is that oftentimes, while you're on it, you don't necessarily connect the things that you're experiencing to it. And in large part because no one necessarily told you that you could experience it. So we all know that not every woman is going to experience the same side effects from hormonal contraceptives. And some women are going to experience more or less, but I have a really hard time after reading the research to say that I couldn't say that I actually believe that if you're on some type of hormonal contraceptive for an extended period of time, 5 to 10 years, I can't actually say that I believe you have none. Mm-hmm. So there's certain things that stood out to me in the research. So one of them, we all know that the whole point of taking the pill is so that it prevents you from ovulating. So in order for it to do that, it has to depress your natural levels of estrogen and progesterone. If it didn't do that, you would ovulate. And obviously progesterone you produce when you ovulate. So so you're not producing progesterone, your natural progesterone. And your ovaries also produce a certain degree of testosterone. So by nature, it also depresses your testosterone production. And so that's a thing. And it's not me saying it. There's so much research around the effect on testosterone that you cannot pretend like it's not there. And that's one of the things that struck me as I kind of dug deeper into that, which is that the studies show that women on hormonal contraceptives will reliably have much lower testosterone, significantly, sometimes like fully half or a quarter as much. And then even after you come off of it, so a year after you come off of it, your testosterone is still lower than a woman who's never taken it. If you're aware or not, or how it affects your body, the question of the how is definitely individualized, but the actual level of these hormones is lower.
Yeah. And I know for me, like too, I don't, like I was saying earlier, like I came to the realization that I actually have very few fertile days. Like I don't produce egg white or watery type mucus. And I have not ever since I've come off the pill. And while it's very possible that there's been other things contributing to that, it's still frustrating to think and to come to the realization when you look at the research, like we went into detail about how it can dry out the crypts and things like that in your in the uterus, and how it depletes, the pill can deplete your stores of things like vitamin A and folate, things like that. And yeah, it's frustrating because even when I think about all the women that, we spend years being so paranoid about getting pregnant. And then when you actually do decide that you're ready to get pregnant, only to come to the realization that it's a lot harder than we were led to believe, right?
Yeah, for some women. And you don't know if your cycle is going to just come back. And that's the part where, the message throughout the podcast consistently has been, and it's not just coming out of my mouth. I used to ask every single guest, what are your recommendations for a woman who's thinking about coming off the pill? And the consistent response is, well, consider coming off of it early. And I feel like that is sound. So I do believe that the pill has a place, but even I pulled up your charts here, and we've spoken a lot about nutrient deficiencies and things like that. And what's really disturbing in the research is that if you thought of all of the B vitamins as a category, so there's vitamin B2, riboflavin, B6, B9 is folate, B12. So all of those B vitamins are really important for your metabolism of a whole lot of different things. And so what reliably happens in study after study is that the way that the pill works and how it disrupts your hormones, it disrupts the way that your body metabolizes those particular vitamins. So there's like years and years of research showing that it depletes folate. And so that effect is exacerbated over time. And so we spent a lot of time talking about how important folate in particular is for cervical health.
Yeah.
And so for women that have, so one of the things that I've noticed just in general from the work that I've done is that for my clients who have been on hormonal contraceptives for a longer period of time, so, talking about 10 years plus, or just generally more than 5 years, I tend to just see it. I see HPV, I see cervical dysplasia, and at some point, and some of my clients have had cervical surgeries, and in the research, it shows that women who have cervical dysplasia that's kind of persistent, that doesn't go away, or have a susceptibility to, we're all exposed to HPV. If you've ever had sexual activity with a human, then it's like the flu. Like there's over 100 kinds of HPV. Yeah. So like we've all got it. Don't think you haven't got it. You have it too. But I'm sorry, but I'm just being honest. But then, as I talked about in episode 95 with Dr. Susan Rako, she did a lot of research in that area as well. And so women who are not on hormonal contraceptives, it's just like the flu. Like we have an immune system and our bodies fight it off. But women who have, are on hormonal contraceptives and have been on it for like the big factor is time. So the longer that you've been on it is that your body just has less of an ability to fight it off. So then it can end up being a little bit more persistent. So the research shows, though, that if they look at all the women with the dysplasia or that have the persistent HPV that isn't really going away, they all have low folate. Like they all have low serum folate. And then B6, B12, it's quite apparent in the research. So in terms of, we've spoken a little bit about this. So to improve your cervical mucus production over time, one of the areas that we want to focus on is just building up those stores of B vitamins. And so, you know me, I'm always talking about how to do it with food first, because I feel like that's the least invasive. And so the nature's vitamin is liver and organ meats. So if you're open to that, great. If you're not, you can look at some sort of supplementation to just help your body to get back up. And if you really want to take it to the kind of like the ideal situation in terms of making sure that you're doing it appropriately, finding a functional doctor or somebody who's able to give you a baseline. These are things we can test, like the joys of modern medicine. So we can test your B12 levels and we can test your folate levels and see where they're at. And then, implement a liver protocol or supplementation protocol. And then 3 months down the line, test again and see if you've seen an impact. And so that's a good place to start. Emily, on one hand, I'm pretty sure to at least someone who's listening, it has occurred to them that, well, why would I want to do all these things to optimize my fertility if I'm trying to avoid pregnancy? Like, why would I want more mucus? And like, why would I want to be more fertile? Does this even make sense? But from a fertility awareness standpoint, it is easier to chart when your cycles are healthy.
Definitely. And that's like, again, as someone who is hardcore avoiding pregnancy, it was still, and I think actually in one of our first sessions together, I kind of joked about that. I'm like, well, this is ideal for now because, it's like an extra backup. But ultimately though, like that's a pretty terrible way of looking at it. You get into sort of the more holistic benefits of charting, and you realize how it really is kind of a barometer for your whole body, similar to like a vital sign, like your blood pressure. Like it's good to see where you're at. And the reason that I think it's important to fix it, so to speak, now, like to try and get my vitamin levels back up is that, if I ever do want to have a kid, I would rather just have these things in place now. So when I do want to, it's much easier, because I think, again, that's one of the biggest sort of tragedies of our current perceptions of birth control is that we spend so much time being so paranoid about it. And this is one of these instances where I'm like, I'm really glad I know this now, as opposed to when, like you said, I want a baby yesterday. Like for those people, that can become a really sort of grueling process. Like if someone really wants to have a child, and then they're finding that it's not as easy as they'd hoped, and then they have to go through the process of figuring all of that stuff out then, as opposed to now, so that then in the future becomes a lot easier to handle and to take steps towards. So like you said, it's easier to chart and it's easier to make decisions when everything is as it should be, so to speak. So I think that that's super important.
Well, and if anyone who's listening is wondering, like, how could it be easier to chart if your cycles are healthy? One of the things, Emily, I'm sure you've noticed it too, is that your charts, I don't know what you've been doing, I suppose they don't look so much different, but I do see some subtle shifts from when we first started working together. And so for what it's worth, we are seeing a little bit more of a healthy pattern, even just we're seeing dry days when you're supposed to have dry days type of thing.
Yeah.
Until you hit your fertile window. But it's easier because if you have a healthy cycle that falls within normal parameters, then you would have menstruation, you would have dry days, you would have a fertile window that would lead to ovulation, and then you would ovulate, and then you would have a luteal phase. And so in that scenario, regardless of when that happens in the cycle, regardless of what day, ovulation takes place on, you have these defined periods of time. You can use fertility awareness regardless of whether your cycle is healthy or whether it's or whether you're having a few of the parameters outside of normal. But in terms of easy too, I guess I should add the caveat that when you're using the method for birth control, that means that there are several days of your cycle where you cannot have unprotected sex, right? Like several days of your cycle where you have to manage that. In a healthy cycle, you would have a group of those days together, and you wouldn't have that many of them. Like you might have a week to 9 days total of potentially fertile days. Whereas if your cycle is not within those parameters, you could have 14 days because you're having mucus and then you don't ovulate and then you have mucus and then blah, 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 blah. So all of that, or, unusual bleeding throughout your cycle, those types of things. And those are days you have to consider potentially fertile. So I just want to paint that picture that it is actually easier to use this method when your cycles are healthy. So that's another motivation to get everything sorted out, and then so much easier when you want to switch over, if you get to the point that you do want to start a family, then it's literally just like, all right, so now we have sex on these days.
Yeah.
Instead, like it's a whole different situation. And so what came to mind as well because one of the things that you mentioned was no one sitting you down and really just sharing what the potential side effects are. Mm-hmm. And so what I've uncovered just as I go through the research, there is a trend, and it's very clear the more of the research you read about hormonal contraceptives. And the trend really seems to be that the pill is really effective. So all of the papers will stress the effectiveness. So it is an effective method of birth control. It's 90-something%. And so we want to talk to women about the potential risks in such a way that won't dissuade them from taking it because it's such an effective method of birth control. And I also noticed this disturbing trend where the research studies, now I'm going to use a real harsh analogy because that's how I roll. So you know how if a woman is sexually assaulted and they put her on the stand and ask her what she's wearing and stuff, right? So they focus on her actions because her actions clearly caused it to happen, right? Like that's not the person who did it. So in the same way, there are studies that examine the behavior of women who complain about side effects for birth control, specifically to find out exactly what qualities of them are making them more susceptible to having these side effects so that they can better understand and identify those women, ultimately for the main goal of finding a way to better convince women to go on it and stay on it, or to help them fact find so that if they don't go on this one, they go on another one. Because the goal is to get them on it.
Yeah, that is disturbing. That's very interesting.
So, I mean, they have to mention the stroke side effect because that could kill you. But then the other side effects are downplayed because the way that it is, even though all women across the board are going to have hormonal disruptions, not all women are going to, quote unquote, complain about the symptoms. So then they can look at that and say, well, a small percentage of women might be affected negatively by these things. So we're going to just talk about the major ones that we have to. So it really lends itself to the perspective that all the other side effects are minor. And so we don't really have to tell women about them.
Yeah. The irony, too, is that whole thing about the study that they did on sort of the pill for men's birth control, and how it got, they shut it down because one guy got like a headache and they were like, whoa, like this is too much. We need to shut her down. Meanwhile, you have like, you have 50% of the population that's, well, maybe that's not, anyway, you know what I mean? Like there's the number of women that are on it and who have side effects and worse on a day-to-day basis, and it's still just considered normal. I think that's very strange and very, very strange. I don't understand, however.
Well, I found that study. It was a very interesting read, as I'm sure you can imagine.
Yes.
And so essentially, I mean, going from that basic biology class level, men and women in utero, babies, before we're formed, our reproductive organs are formed from the same parts. So, you know, before we can tell what gender a baby is, the baby is what's called undifferentiated, meaning that we all have the same stuff and then each part morphs into our respective, you know, penis, vagina, vulva, testicles situation. And so what was interesting in the study is that essentially the side effects that men were having mirror the side effects that women have, which is depression, mood changes, and, you know, loss of libido. Some of the participants experienced erectile dysfunction. There was one participant who killed himself, but in the study, they noted that they have concluded that that was unrelated. So he had 3 months where he had a shot because it was an injectable contraceptive. So he had the shot for 3 months but they decided that it was unrelated. I'll just leave that one there. But yeah, so there was a safety committee that I suppose the safety committee doesn't just apply to this study. It's probably enacted for all studies because you have to get approval ethically to do studies. But the safety committee decided that because there was a number of men who were experiencing kind of depression, mood effects, a few men dropped out of the study because of erectile dysfunction, other mood disorders, they decided that it wasn't safe to continue. And so they stopped midway.
Yeah.
Meanwhile, I'm reading these side effects and they mirror the side effects that women have, depression, mood changes, etc. And where's the safety committee for us?
Yeah. It's really weird. And I totally get the idea that it's difficult to prove causation, right? Like, especially with something like the pill, like there's a million things that are contributing to people. And that's why I find it even funnier that they're trying to figure that portion out more. Like, of the millions, or I don't know the statistic, I shouldn't throw numbers out there, but of all the women that are on the pill, and trying to find patterns in their behaviors to explain these things, like that seems like the biggest waste of time to me, because I'm like, you're not going to find it. Every woman's life is different, right? But when you have these sort of sweeping patterns, like they found, like with these side effects, seems very, very counterintuitive to me that the first thing they decide to do then is look at, all of these other factors that could be contributing to those side effects. And it's like, well, why wouldn't we just be honest about it and say, look, a lot of women who take this experience this, this, and this, and those things are also, caused by many other different things, but just putting it out there, we can let women make those decisions for themselves, right? I think that's the biggest thing is when you provide information to women, they can make decisions as opposed to just blindly going along with whatever their doctors are telling them. And you know what, if people are willing to, because again, the pill is super effective. And like I said, for some people, it seems to be a good option. And I think though, as long as they're presented with all of the information, then they can go ahead and choose to do it. But I think the biggest problem is that not all doctors are telling all of their patients about these things. And I certainly was one of those people. I wasn't told anything about the side effects except for a stroke, which I told was not to be, didn't need to be concerned about because I didn't smoke. And that's a problem to me. That's not how you administer a powerful hormonal medication. I have issues with that. I think I think just all of the information needs to be available and women can make decisions for themselves. And without that, it's not ethical in my mind.
Well, and what you described is essentially informed consent. And so
yeah,
if I had my way, then again, it's not about saying that, because what I believe fundamentally is that if women were just advised in an honest way about all of the possible side effects, so not minimized just because maybe the chance is slim, but advised of all of the possible effects of this hormonal contraceptive, that women would still, there's a percentage of women that would still take it. But I would imagine that many women would take it for shorter periods of time. So kind of, okay, this is really good for me now. I'm really glad I know that it could be related to certain other types of things. So I'm going to make the informed choice to take it now. But because I know these other things, I'm probably not going to end up on it for 16 years.
Right.
Maybe I'll end up on it for 3, and then I'll reevaluate and see if it's still right for me. And I feel like that is the essence of informed consent, where you, and then the other piece of it is that if you don't know that something could potentially be related to something, so, again, so there's a lot of women who do develop depressive symptoms, anxiety, loss of libido, and that can be gradual. Pain with sex, that was something that was really disturbing in the research. So specifically because the pill has been associated with shrinking your clitoris, that's an actual thing. And it's not there's studies that measure the vascularization of the clitoris of women on the pill, and it shrinks it. And then other tissues around the vulva and vulva opening, women who are on the pill have a thinner, it actually thins the tissues. And again, this is an actual thing. There's research showing it where people have actually measured the thickness of these tissues for the duration of women on the pill. So pain with sex, difficulty orgasming. And then you would be really surprised at how much research there is about how the pill can potentially affect your pheromones and affect how you choose your partner. So it sounds a little airy-fairy. I've read articles on the internet where it kind of almost sounds funny, like, ha ha ha, you might go off the pill and not like the smell of your partner. But there's a significant amount of research that has been done in that kind of evolutionary biology standpoint, where they actually can measure your genetic makeup and then the genetic makeup of your partner. And so that's an actual thing where they can tell how similar and dissimilar you are. And so, for example, women who are taking hormonal contraceptives are more likely to enjoy and be attracted to the smell of another person that has genes that are more similar to theirs. Whereas when you're not on hormonal contraceptives, you are more, and they do all these studies, they seem kind of sexist, but it's like you're more likely when you're not taking hormonal contraceptives to be attracted to, from a heterosexual standpoint, men who are more what quote unquote masculine and dominant. So they have these men fill out surveys and give them markers of dominance. And they actually do these things where they change the facial features to make men look either more masculine or feminine. And so it affects that. And it's not like there's one study. There's like many. So what I wonder is, when is the action and the, from your doctors and things like that, like, when is this research going to get into your doctor's office? When are you going to be considered an equal participant in your medical care, such that you have the right to know? Because it doesn't mean this is going to happen to you, but I would want to know that it is possible that any of these things could happen, because then I get to make an informed decision about my medical care.
Well, and I think that's just how, like with every other medication, that's what it is. Like, you kind of laugh when you see those ads on TV in the States for certain medications. And at the end, it's like, this can cause risk of blah, 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 and death. And you're like, oh my God. Okay. And like, you know what I mean? Like, there's still people taking it though, and they're perfectly fine. And that's great. But the fact is that you can't be on the lookout for symptoms that you don't know exist. And I think that, like I said, my acquaintances and my friends, for example, my one who had chronic migraines for years, like, she had to deal with chronic migraines for years because she wasn't aware. Whereas maybe if she had been aware that, one of the side effects that's been found is migraines and things like this, she wouldn't have had to deal with that for years. Like, that's the way it gets me, is it's years. And it's like, they look at everything else first. Like, she was getting CAT scans and like all kinds of stuff. And then it turns out that it's just, and it was her, like, and her doctor who was great. She had a good family doctor who eventually was, they're looking at all this stuff, but I really think that maybe we should just see what happens when you stop taking the pill. And she did. And poof, like, gone. And it just sucks that it took years for them to come to that conclusion, because that's years of discomfort for her. Right. And just like any other medication, you can't, like I said, you can't be on the lookout for symptoms if you don't know that they're symptoms. I think that that's very problematic, and it makes no sense to me that it's not more widely explained. Because again, like you said, it doesn't mean you're going to get it. Like, I didn't have any of those side effects. I had a great time on the pill, for what it's worth. But the fact is, there's lots of women who don't have that experience. And I think it's ridiculous that their symptoms and their discomfort or whatever they're going through is not considered important enough to merit making these kinds of decisions. I don't know. I find that very unfortunate.
Well, and I mean, we've spoken about it a little bit, but every woman reacts a little bit differently to the pill. And I think that in your case, so you didn't have any overt side effects, but then when we've talked a lot about mucus production, and we spoke about that a little bit in the podcast. And so from my perspective, I have to wonder, is that related? And so from what I've seen with the women that I work with, I would say that is a side effect that, who knows about that, right? I mean, unless you listen to this podcast or, I don't know, are taking the Justice training, I don't know. Yeah. Like, how would you know that hormonal contraceptive use, long-term hormonal contraceptive use, is associated with potentially reducing your fertile quality mucus, which then does have an effect on fertility, potentially. Yeah. So this is an atypical session. Part of the reason, Emily, that we went on all these tangents today is because I know before we had our session, I asked you if there was anything in particular you wanted to talk about. I know you're feeling really confident about using the method for birth control, and we've had several sessions together, and we had lots of time together in our group session. So I know this was less of a like, and I'm intervening and telling you all kinds of stuff, and more of a shared discussion about the hormonal contraceptive situation. Yeah. But before we close our conversation, was there anything that you did just want to talk about, or anything that came up throughout our discussion?
Not in particular. I think, no, I don't think in particular. Something just that beyond getting past the deprogramming that we talked at length about, something I had a hard time doing, and something I still second guess on sometimes, is telling the difference between vaginal cell slough and cervical mucus. And I find, for me, part of the confusion that came from that is I would have stuff on my underwear, but there was nothing coming off when I was doing the tissue wipe. But I became very paranoid about that, because I was like, oh, maybe there's just not enough coming, like maybe, because I didn't want to make mistakes. And I have from what I've gathered, that's a fairly common experience. And I found, though, particularly in my last 2 charting cycles, particularly this cycle, my confidence in the method has improved a lot, largely just being able to tell the difference between those two things. But other than that, that's really sort of the only thing that I sometimes am not 100% sure about. But generally, again, I think it's improving. So no, nothing other than that in particular about my charts that I've been wondering about or concerned about at this point.
Well, and it makes me think of something. We spoke about this a little bit, and when you first learn the Just Ease protocol, it involves a lot of wiping. It's just you and the tissue, and you're together all day, and you're wiping a lot. Although I always point out that you're wiping anyways. So, everyone who's listening goes to the bathroom several times a day. So you're wiping anyways. We're just doing it in a conscious way, but I digress. But I think that type of routine can give you the impression that it's supposed to be hard to find cervical mucus and you have to look for it. And I know there's a lot of women who really feel like they have to kind of dig around and find it. And so the takeaway there, and as your cycles do progress, because now, we've already seen a shift in your cycles, and as you kind of incorporate everything that we've talked about and all the different things that I know you're working on outside of our work together, I think that within several cycles, a few cycles, you'll start to see a shift. And so in a healthy cycle, kind of going back to that idea that a healthy cycle is easier to chart, you don't have to search for it. Part of the reason that we check so frequently is more to get a sense of how much you're seeing, how many times throughout the day, and to get more of a sense of like the quantity and the quality and all of that. But it should be very obvious when you shift from your pre-ovulatory infertile phase to your fertile window. And so that kind of point of change between your dry days and your mucus days, it should be obvious. And then when you have days of, peak quality mucus, again, it should be super obvious in a healthy cycle. So then there's a huge difference between wiping, having a smooth sensation and having nothing there all day, to having like a very clear peak mucus observation several times throughout the day. So maybe that can kind of reassure you that in those times, right? Like, and I know that you know that from all of our group discussions that we had.
Yeah.
But hopefully that helps a little.
No, it is. It is helpful. And it's just, it's good to have that reminder every so often. Again, I think it's part of my deprogramming my own paranoia, but it's, no, it is. That is super helpful. And it's gotten a lot better. Like I feel like I've come leaps and bounds from 10 weeks or 11 weeks ago at this point. So that's been great.
Well, I've been thrilled to be part of your journey, Emily. You are really fun. I love your sense of humor, by the way. You always have me busting a gut. I love it.
Oh, good.
And so just to tie everything up, I mean, for the listeners, what is something that you would want them to take from our conversation today?
I think just one takeaway. Honestly, I think it's just that trust the method. If you haven't tried Just Ease, I would highly recommend it. I'm not being paid to say that. I really do, though. It was so incredibly helpful to me. And I think cervical mucus is tricky for a lot of people. And I know the frustration is real when you first start charting. And I think that just patience and just, again, trusting the method, super, super important. And it will get you there. Like I said, it's gotten me to a point now that I'm much, much, much more confident. And also, I guess, actually, the big takeaway is get help if you're not confident. Like I said, it took me a year doing it on my own before I was like, look, I feel like it's been a year and I'm still not comfortable doing things. Do get help. And I know it can be hard to find resources, but like things, if you're listening to this podcast, you already have access to some great resources. But don't be afraid to ask for help, because it does. It's life-changing. Sounds very dramatic, but it is, though, for me. It has been life-changing. I'm very appreciative of the help that I've gotten from you and the other ladies in the group, and all of the people in the community. Really, it's a great community. So yeah,
I'm so happy to hear that. It makes me happy because that's exactly why I do this, because for me, it obviously changed my life and it made a huge impact. Mm-hmm. And it was what was most poignant about that was that, it was just birth control or whatever. This is kind of cool. And it morphed into like, oh my gosh, like this is really like integrated to my health. And so anyways, like I'm really happy to hear that. I'm really glad that I was able to support you and to meet you and have you as part of the group program, and also on our live air client session that was kind of more like a pill discussion.
I'm sorry. I felt like it was a vent session for me. I'm sorry.
Yeah, no, I was participating. We need to have more conversations about the pill. So I'm glad that we did have this discussion. And I know that a lot of women listening are going to find it to be really beneficial and eye-opening. So thank you so much, Emily.
No, thank you for having me. It was great. It's been a great journey. So thank you.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/132. I hope that you enjoyed my episode with Emily. It was so much fun chatting with her. And it's funny because after we finished our interview, we actually ended up chatting for quite some time after the interview because we're just chatty people and we just have so much to say. And so as you can tell, this episode is a little bit different from some of the other episodes that I've done. And I think it just speaks to the uniqueness of each of the women that I work with. And so I work with women who are in different stages of their knowledge. Sessions are often different at the beginning of our work together. So the first few sessions versus as we get more comfortable and confident, depending on what's happening. If you're having specific questions or specific challenges in a particular area, then we obviously focus more on that. And, in the case with Emily, because we had worked together for quite some time, and because she really got to that point of being super solid in her knowledge and understanding of her cycles. We had hashed out so much in our previous sessions together. Really, this was more of a check-in, and we ended up going on, quite a bit of a tangent because we're both really passionate about hormonal birth control and just the impacts that it can have. And so I think it's really important just to take a high-level view of these things. I think that although the general way that hormonal contraceptives are put out in the world is that they're not overly harmful. There's not really any risks associated with it, and your chances of having any type of negative effects is really low. And I think that is an interesting perspective to take because I feel that it doesn't take into consideration the potential impact of long-term use. So when I say long-term use, I really would say anything 2 years or more, but 2 years, 5 years, 10 years, 15 years. I feel that based on, everything that the research shows, based on my experiences working with women in this field and really having that window into their overall health, because that's part of what I look at when we do our intakes, is that I don't believe that a woman could be on the pill for 10 years, 15 years, and it have no effect. And it's not just about me believing it. It's actually understanding the hormone cycles and understanding how they interact with each other. And also understanding what the research shows about it, because it's right there in the research. The whole reason that the pill works is because it disrupts your hormones. So every single woman who takes it has a disruption in her hormones across the board. It is not a side effect that only happens to some women. It happens to all women. And I think we need to know that. And that is why it works. So the whole reason that it works is because it really shuts down your ovaries' ability to produce sufficient estrogen to trigger ovulation. And if it didn't do that, it wouldn't be effective as a birth control method. So it is intertwined with the very reason that we use it, that it does disrupt the hormonal balance. And it's not just estrogen and progesterone, but you can't interfere with one aspect of the body and expect that no other aspects of the body are connected. And so I hope that is one of the takeaways that you took from this episode, because obviously Emily and I went into that and talked about it quite a bit. But I feel that it's really important. Although, the chances of you having a life-threatening effect from taking this medication, it's not zero, so you can put it that way, but it's not, high. Obviously, most women who take hormonal contraceptives don't have life-threatening side effects, but we can't let that make us believe that there are no other effects. So if you're interested in this topic, if you're new to the show, if this is one of the first episodes that you're hearing and you would like to hear more information about hormonal birth control, I have done quite a few episodes, interviewed quite a few guests specifically on hormonal contraceptives and the effects that it can have on the body. And I think it's really important to have a more detailed understanding of the far-reaching impacts that you wouldn't necessarily expect. And so that includes things like the effects on mood, which means, includes things like depression, anxiety, panic attacks, things like that. Physical side effects where it can actually, we've talked about it, but it can actually have a physical effect on your genitalia. So there's studies showing linking hormonal contraceptive use to literally shrinking your clitoris or changing your vulva tissues, and thus the impact of that is that it can lead you to have more painful sex. So on top of that, if you're on hormonal contraceptives, you're more likely to have a difficult time reaching orgasm, or even potentially losing that desire to want to have sex, or having that impacted in one way or the other. Now, overall, the impression that I've received from women throughout the years and throughout the 2.5 years that I've been podcasting is very much that when these things happen, because we are not told in advance that they could be related to hormonal contraceptive use, and these are not the only impacts, these are just the ones I'm talking about, right now. But because we're not really given a heads up that, okay, it could be related to this. So if you start having panic attacks, you really want to look at this pill thing. If you start to notice that sex is painful, don't just think it's you. You want to make sure to look at this pill thing. Or, if you find that it's difficult to orgasm, or you're not lubricating during sex and you're finding that it's really uncomfortable because you're super dry, or you find that you're not really into sex that much and you don't have much of a libido to speak of, don't think it's you. Really look at this pill thing. So if we were told that, if that was put on our radar, then at least if it happened, we would have that little bit of like, okay, so this is happening. Somebody told me that it could be related. Let me just do a little experiment. I'm just going to go off of it for 3 months and see if anything changes. And then at least if it doesn't change, I know that it's not this, so that I know that I can go back on it. But to not have that foresight is a problem. It's unethical. And really, it is not informed consent. And so that little ranty, I feel that it's important, and I will be talking, a bit more about the pill in upcoming episodes. I've alluded to it a few times, like I have some really interesting interviews coming up just with members of the community who've had different experiences on hormonal contraceptives that I feel are really important and need to be shared. And so we're going to be talking a little bit about that. So why don't you let me know what you think about this topic, if you'd like to hear more about it, because I certainly have a lot to say about hormonal contraceptives. And so if you're interested to hear more about it, let me know. You can join me in my Facebook group. So fertilityfriday.com/community is where you go, and you'll be redirected to the Fertility Friday community Facebook group, where we're going to be talking about these topics and, really anything related to fertility awareness, hormonal health, all those types of things in there. So that's a great place to connect if you're wanting to hear more about that. And so I'll just leave you again with the link to the group program if you're wanting to join us in there, fertilityfriday.com/group program. And I want to thank you so much for taking time out of your day to listen to the podcast and support the show. I really feel like we're forming such an amazing community. I swear, I just have the nicest women. I always say I attract the most amazing women working with me, my clients, all of the women in my group programs. It is just, is truly amazing just how, and I'm not just saying that, how sweet, how kind, how generous and supportive the women are that I have the pleasure of working with, as well as the women in the Fertility Friday community. So I really do appreciate all of you. It's really because of your support and encouragement that I continue to podcast, because now I know that you're there, and I know that you're listening, and I know every week you're wanting to hear from me. And so it really gives me the encouragement that helps me to just keep going and keep making these episodes for you and keep sharing this information. And so thank you so much. And as always, until next time, be well and happy charting.